Hello everyone. Today we will discuss about one important topic, that is SIADH, syndrome of inappropriate release of antidiuretic hormone. So SIADH, as the name itself will tell, there will be inappropriate release of ADH, that will be in excess. So antidiuretic hormone will lead to more than usual concentration of the urine. So more concentrated urine, that in turn lead to more fluid reabsorption. So this is the overall mechanism. There will be excessive antidiuretic hormone. It will not let the renal mechanisms to lose water. So there will be more reabsorption. That's why there will be formation of concentrated urine. Now, from where this abnormal ADH is getting released? So conditions which will lead to SIADH, especially respiratory system, there will be pneumonia, simple pneumonia sometimes might lead to SIADH, even pleural effusion or tuberculosis, sometimes even small cell carcinoma of lung. This is in respiratory system. Then in CNS, it can be because of meningitis. Some tumors can release as paraneoplastic manifestation. Then subarachnoid hemorrhage might be the reason for abnormal ADH secretion. And one more thing is few medications, especially SSRIs, can lead to SIADH. So these things have to be assessed when we get a case of SIADH. Now we will see the pathophysiology, what is happening in a patient with SIADH. So all these conditions are releasing ADH. Now what it is doing? So coming to the mechanism, here we know that kidneys concentrating ability is the major thing. Now because of excessive ADH, it is leading to increased concentrating action by renal system. So in turn leading to increased fluid reabsorption. But this fluid is sufficient enough to stimulate natriuretic peptides. That is ANP, BNP. So these peptides will further cause loss of water and sodium. Now the thing is, this reabsorbed water and later on lost water will get balanced. So there will be no net loss of fluid, from the body. That is, it will be euvolemic. But we are losing sodium. So loss of sodium will lead to hyponatremia. So at the end, this SIADH is a condition which will lead to euvolemic hyponatremia. So the patient might present with the features of hyponatremia: headache, nausea, vomiting, confusion, etc. Now to evaluate this condition, we can analyze the mechanism again. Here there will be loss of sodium. So obviously there will be hyponatremia. So serum sodium levels will be lowered. Then clinically patient will be euvolemic. And because of this natriuresis, we are losing excessive sodium in the urine. So if we get urinary sodium levels, it will be more than 20 urinary sodium. And one more thing is, here kidneys are concentrating more than their ability. So there will be formation of concentrated urine. So remember one thing, whenever there is concentrated urine, uric acid will be lost in that concentrated urine. So serum uric acid levels will fall because uric acid is getting lost in that concentrated urine. So if serum uric acid levels will be majority of the times less than 4 milligram per deciliter. So these are some biochemical markers when we are working up a case of SIADH. And if we want to find out the cause proper, we have to keep the possibilities of the common causes we have listed out just now. So this is about the mechanism. Coming to treatment proper. So how to treat? If we get the cause, we have to treat that particular cause. And as a symptomatic measure in treatment, we can use tablet furosemide 20 mg 100. As we know, this is a loop diuretic, and loop of Henle is the site of concentrating action of the kidneys. So we are blocking that action. So blockage of concentrating ability of kidneys. So as there was excessive concentration in SIADH, we are blocking that action. So this will lead to loss of water also. In turn, balancing sodium levels. Second option is we have to advise for salt tablets and advise for fluid restriction. We can even utilize Vaptans, especially tolvaptan. But always remember, just we have to use this for 1 to 2 months only. Otherwise, it will lead to liver toxicity. This thing has to be kept in mind. So in this duration, we have to find out the exact cause for SIADH and we have to focus on treating that particular reason. So this is about SIADH. Thank you.